We can try to avoid changes in body shape by supporting and educating families and carers on the importance of postural care. Postural care is about using the right equipment and positioning techniques to help protect and restore body shape. It's what we do to help a person lie, sit and stand in a good position over a 24-hour period. The physiotherapist will assess the person you care for and devise a postural management plan.
I think it's important to look after your posture 24 hours a day. I think it's important because I spend a lot of time in my chair.
I think traditionally you could have brought up with it, everything's about equipment, which is generally through the day, and so for a lot of the times at night time you don't particularly think that counts, it's sleep. But actually that's probably the longest period that Cara is out of support, if you like, and so that was probably the most detrimental time.
The person being cared for spends their time in various positions. Therefore, all carers need to be given the right support, information and training on postural care.
First was introduced to postural care by Michelle at PAMIS. We had been to a few workshops before, and Michelle had suggested that this workshop might be beneficial for us, and she obviously knew us and she knew Cara and the issues that we were having, and I went to a 2-day course with a whole group of other parents. We went on to get accreditation, and we actually all managed to get our level 2 in postural care, and it was fantastic and it was totally life-changing.
We received an information letter in to go to a 2-day training course about postural care, and I went along on my own and I couldn't believe what I saw. I was shocked, and I came home and I told David, and I had such a passion for it from day one. So I decided that I would like to sit the accreditation, and I've really enjoyed being part of the postural management planning team. It's been great, and as I say, I've got such a passion for posture, and I think I always will have.
Having worked with the community physiotherapy team, we've gained an awful lot of knowledge on postural management through them. It's something we hadn't given a great deal of thought to before, but having gone through the process and learning the importance of it, it is very important to listen to what they tell you and try and carry out all their instructions, because they're only doing it for your good, and it's to save you from any problems later in life.
And I didn't find any of it challenging or difficult. I just found it so interesting, and I really enjoyed mixing with all the other mothers and finding out how interesting and easy they found it as well. I think when you've got a passion for something, you're determined to learn it, especially when it's somebody you're caring for and it's a health benefit at the end of the day.
The physiotherapist should provide training and education on the importance of postural care and how best to support the person's posture.
Occupational therapy is all about involving people in daily activities as independently as possible. Posture is vital when taking part in these activities, particularly if a person has a difficulty with controlling their physical and motor skills. Being part of an activity or not is very dependent on posture. The occupational therapist will assess for specialist seating. This seating will help to support the person in order that they can then use their hands to operate a switch, to play with a toy, to hold a spoon, or even to have their head more stable in order to make choices or to communicate. A child in a classroom will be able to learn much better if they're not concentrating on their posture, and that they are well supported to be able to look, listen and learn. Can you imagine trying to balance on one leg or sit on a ball and thread a needle? And this is a type of difficulty that someone may have if they're not in good supported position.
Posture and positioning is really important in maintaining a safe swallow. Good posture and good positioning can support a swallow that's safe, that's comfortable and is coordinated. Poor posture and poor positioning can lead to a swallow that's difficult to trigger, that can be uncoordinated and can even be painful or uncomfortable. That can lead to an increased risk of choking and a greater risk of food and fluid entering the lungs. When food and fluid enter the lungs, we call this aspiration. And aspiration can cause recurrent chest infections and aspiration pneumonia. This can happen not just through the food and drink that we're eating and drinking, but also from stomach contents such as reflux. And that's why it's important to maintain good posture and good positioning, not just throughout the mealtime, but after the mealtime as well, to reduce the risk of this happening.
I use my wheelchair when I'm eating and drinking because it gives me a good position.
What else helps you? Your feet strapped in at your foot plates, don't you?
Feet strapped in at the foot plates.
And that helps to stop you from what?
Shooting.
Shooting your legs forward, doesn't it?
Yeah.
Right, what other thing did you just get with your new wheelchair?
A headrest.
So what does that do to your head?
Keep my head in a nice position.
So we're really looking at Robert all the time, watching his feet, making sure that Robert's hips are aligned in his chair, keeping Robert as straight as he can, because he does have a tendency to move over to the right hand side. Robert doesn't have great head control, but he has a collar that he wears that he sometimes likes to try and pull off. So it's just really making sure at all times you're doing your best for your son or the person you're caring for. And also when Robert comes in from school, making sure that he's straight in his chair, obviously keeping his bottom as far back as you can in the chair, and just making sure that everybody that works with Robert has that knowledge as well.
Simple things like making sure the straps are on properly, or belts on properly, that it's on tight enough to give her the support that she needs, because that's what these things are there for. They're there to give her body support. And I think until you actually realise that that's what they're actually in place for and help, obviously Cara's got quite a bit of movement, and so if she's not got her straps on properly, she can actually move herself out of a good position into a bad position really quickly, and that means that she's in pain, and then she gets upset, and then it's just the whole bad cycle again.
What kind of bed do you have?
A hospital bed.
With electric?
Electric. Control.
What can you do with the bed?
Put it up.
Down and change the angle.
Right. That helps me makes me feel more comfortable.
And what else helps you during the night?
Sleep system.
And how does your sleeping system work?
It keeps me in a nice position.
And what do? We put pads in?
Pads.
At each side.
Yeah.
And a big pad at your leg.
Leg.
And what does that stop you doing?
One sweeping.
And sweeping over, doesn't it?
There's 2 pads.
And where do they go?
In between my legs.
And beside at your hips, isn't there? And there's another one. What's the other one for?
Knees.
And then what else do you put your legs over?
A T-row.
A T-row. And what does that do?
It makes me lie very still.
And very straight.
Very straight. When I'm in a good position, I don't have any pain. That makes me have a more comfortable night's sleep.
When we put Robert in his bed at night, we make sure he's really straight, right? We get his happy legs out, we put them on, yes, and then we get the 2 triangles out. Dad puts one in here this side, and we rotate his body here, over here, and then Mum gets this side, and then we rotate the body here, and you stand at the bottom of the bed and you make sure there's an imaginary line and it runs all the way down to the bottom. Then, because he's a tricky customer, we take the 2 sausage rolls and we put them in here. Yes. Sometimes we have to readjust them because it gets wriggly.
Good position should be comfortable. However, it is recognised that initially a person may feel uncomfortable, as this is a strange position for their body to be in. It is important, therefore, to build up the period of time that the person is in the seating or the piece of equipment. The occupational therapist could also advise on an activity, and hopefully if the person is involved in an enjoyable activity or a fun activity, this will also help with promoting the good posture and tolerating the piece of equipment.
Now implementing the postural care, I feel as though I can get Cara into a really good shape. I can get her into a symmetrical lying position. Her hips, her knees, her ankles are all in good positions, and she's comfortable. And I think that's the main thing, is that this isn't something that we do to her and it causes her discomfort. It actually helps her comfort, which is something I think that it took us a little while to get our head round about that.
If Robert's in the house and he's in his room just watching television, he's got to be correctly positioned in his bed. There's no lying up in the bean bags anymore. And it is a very comfortable position for Robert. He's the position that he's really happy in.
Good positioning is vital for a healthy digestive system. By allowing food to go down the correct way, it reduces the risk of things such as acid reflux and heartburn, and also maintaining good bowel health. If a person being cared for is receiving their hydration, nutrition and medication through a tube, either through their nose into their stomach or directly into their stomach, good positioning is essential for reducing the risk of aspiration. Maintaining good positioning can allow someone who is being tube fed to be involved in the social aspect of a mealtime.
If we've got good posture and good positioning and we're able to engage with our environment and with people in our environment, then that can lead to increased opportunities for communication and increased abilities to have positive interactions with those around us. An individual approach is really necessary to ensure that the person is able to make use of their own communication skills and are able to respond appropriately to the communication attempts of others in their environment.
It's also important to consider the environment, as distractions, noise or excitement can alter a person's postural tone. The occupational therapist will advise on the positioning of an activity and also factors within the environment that may have an impact on posture.
The CPIPS pathway is a national measurement tool used in Scotland. This was initially developed in Sweden. If the person being cared for is a child, the physiotherapist will regularly measure the amount of movement at their hips and check how straight their spine is. The children are also offered x-rays at set intervals to check their hips. This is done until they are 16 years old and into adulthood if required.
Our scoliosis hasn't deteriorated greatly since we've started implementing postural care. Obviously she had scoliosis before we started this, and she still does have scoliosis, but it hasn't had any drastic change, which is great for everything. She's got a better sleep pattern, she sleeps better, and obviously a lot of that's down to being comfortable.
I'm always looking at Robert's body shape, especially when he's in his bed at night. I'm amazed how his rib flare has changed, and I'm always very concerned about Robert's spine. Robert has a baclofen pump inside his body, just under his rib cage, and there is a small catheter which is inserted in the internal part of Robert's body into the base of his spine, so he has a kind of X marks the spot, you could call it that. So I'm always looking to make sure that X marks the spot is at the base of Robert's spine.
It's important to note that a person's posture is always changing, and we need to remember to always be discussing postural care on a regular basis. Postural care is as important as taking your daily medication and should be an important part of your daily routine.